You've made it. A new country, a new beginning. And the dream of becoming a nurse in Canada or the US is becoming a reality. You are thinking, I just need to get there. I'll get registered as a nurse and I can start working right away. But then you get here and reality sets in. You find out the path to becoming a licensed nurse here isn't always as straightforward as it seems. The NCAS process feels overwhelming, and the SLA assessment, well, where do you even begin? You don't know who to ask and what questions to ask. You might even say to yourself, I don't even know what to study for. Ugh, I need help.
Preparing for any exam can be stressful and overwhelming. And if you're an IEN preparing for your NCAS, more specifically the SLA, don't worry, I got you. In today's video, I'm going to help guide you step by step on how to prepare for your NCAS SLA and what you need to focus on during your assessment. For the RN SLA, it will be 5 case scenarios, and for the LPN, it will be 3 case scenarios. For the case scenarios, 2 will be with the trained actor who will act as your patient, and 3 of those case scenarios will be with the mannequin. Each case scenario is 25 minutes, so in total, it'll be 3.5 hours for the full assessment. Now let's talk about the actual simulation. First thing you need to do is familiarize yourself with the case scenario, starting with the patient's name, because you're going to be using this later on when you say hi to the patient and when you introduce yourself. Next, what is the reason that the patient is here? What's the current diagnosis? What's the main symptoms of the patients? Because that's the reason why they're here, why you're taking care of them. Next, what are the medications the patient is currently on? Medications that were given last night, for example, if you're working the day shift, and what kind of PRN medications you can give to the patient if the patient complains of something. Usually during a simulation or a case scenario, during your head-to-toe assessment while you're in the middle of it, the patient might be complaining of something. It might be shortness of breath, chest pain, or some type of pain elsewhere. And what you're going to be assessed is if you know what kind of assessment you need to do, what focus assessment you need to do, and also what kind of medications you're going to be giving if needed, what kind of interventions are you going to be calling the doctor, right? So those are the things that you need to be familiar with before your NCAS SLA or your CBA as well. Also, are there any doctor's order or standing order? And also, if you're given blood work results, make sure you familiarize yourself with any abnormal results as well, because this might come into play during the case scenario. I appreciate each one of you watching these videos and subscribing to my channel. So as a thank you, I created a survival guide for IEN workbook in Canada. So make sure you download that one. I'm going to put the link in the comments and in the description below as well. It's a guide to how to prepare for your NCLEX, how to prepare for your NCAS, your CBA, SLA, time management tips, productivity tips, and also how to take care of yourself while doing it all, because it's a lot, and also how to manage your test anxiety. So if you're interested, make sure you download that. You can go to my website as well, Nursing Collective Co., or otherwise just click the link below. Now we're ready to take care of this patient once you have all that information. So first thing you need to do though is wash your hands. So do your hand hygiene and then don the necessary PPE. Also check if there's infection control sign on the patient's bedroom. And then gather your equipments like your stethoscope, okay, blood pressure cuff if needed. If it's not in the room yet, you can ask the instructor for that, and also your pen light. Now, once you're in the patient's room, you need to introduce yourself and explain the procedure. So you can say something like, hi, good morning, John. I'm Ira. I will be your nurse for today. I will be here from 7 a.m. to 7 p.m. Are there anything that's bothering you that I can take care of right now? If the patient says, no, I'm okay, then great. Then you can get started on your head-to-toe assessment. So you have to, before you can begin your head-to-toe assessment, you have to ask the patient for permission first. So you can say something like, I will be doing a head-to-toe assessment just to check your overall health. Will that be okay with you? It will take about 20 to 25 minutes. Once you have obtained consent from the patient, now you can get your safety check done. Safety check is making sure of the patient's safety and also your safety and all the equipments in the room. So If a patient deteriorates or an adverse event happens, you have all the equipments that you'll need in an emergency. So you have a bag and a mask, the suction is working, the bed alarms are on, the bed is at the lowest height, the call bell is within reach, ensuring the bed space of the patient is tidy, it's safe, it's free from harm, there's no Foley catheter on the floor, or any safety hazards that will make the patient a fall risk. Once you have all that done, then you're going to assess the patient's general appearance and mental status. So while they're sitting down, how do they look like? Or if they're lying down on the bed, are they having difficulty breathing? Are they having difficulty talking to you and answering questions? And then you're going to assess the patient's mental status. Okay, ANO times 4. So alert and oriented to time, day, place, and situation. So you can do that by asking the patient, can you tell me your name, the time, and do you know where you are and why are you here? Don't forget that while you're asking those questions about ANO times 4, that you're also checking the patient's ID band for their name and date of birth. And then you can also assess the patient's posture, their hygiene, and overall demeanor. So how are they feeling? Are they depressed? Any anxiety? Because those are things that you need to address as well if needed.
After you've checked patient's vital signs, you can start inspecting the head. Palpate the scalp for any lumps, bumps, protrusions, indentations, any laceration, any pain, especially for older adults. Then, check the eyes for any drainage or any internal bleeding. Grab your pen light and then check the GCS. Check for the pupils for size, equality, reaction to light, and consensual reaction to light, or PERLA. Make sure you do both eyes. Then check for facial symmetry, no drooping, no swelling. Check for nasal trauma and patency. Then inspect the mouth. Check the tongue, the teeth. Check for moisture, color, dentures, and hygiene. Then check the ears for any drainage. Again, do both ears. Check the lymph nodes of the neck. You shouldn't feel any of the lymph nodes as that will be an abnormal finding. Then check the thyroid gland, palpate the symmetry of the trachea. Grab your stethoscope and we're gonna listen for bruit. Use the bell of your stethoscope and ask the patient to hold their breath and listen for any whooshing sounds. If you hear any whooshing sounds, then that's what's called bruit, and that's an abnormal finding. Then you can also check the carotid arteries for any jugular vein distension or JVD. Chest assessment is one of the most important part of the head to toe. Start with inspecting the chest. Assess by just looking at the patient's chest that your patient is breathing easy and there's no use of accessory muscles. Assess for respiratory rate and any difficulty breathing. Make sure you compare the right side to the left side of the lungs. Then grab your stethoscope to listen to lung sounds. Using the diaphragm of your stethoscope, we're going to listen for lung sounds. So assess for any adventitious sounds or any abnormalities. Before you go for your SLA or any head-to-toe assessment simulation, make sure that you are familiar with the adventitious sounds. What does it sound like? So the wheezing, the crackles, any pleural rubs. And then you know your landmarking. So using the diagram here for the anterior and posterior view, make note of the landmark where you're going to auscultate. And then you're going to do it for the right side and the left side. Next, we're going to listen to heart rate. So we're going to listen for apical pulse. We're going to look here at first. So it's in the left center of the chest. Okay, and it's below the 5th intercostal space at the left mid-clavicular line. So you're going to locate the 5th intercostal space. Also a note, if your patient is a woman, and the patient has a big breast, you have to lift that breast so you can listen properly. Again, mid-clavicular line, 5th intercostal space, and just below the nipple. Use the diaphragm, listen for that apical pulse, and you have to listen for 1 full minute. This is also known as the point of maximal impulse or apex beat. We're going to do abdominal assessment. So if you can lift the patient's shirt with patient's consent, then that's good. And then just check for any shape, skin abnormalities, any masses, any movement. Then we're going to auscultate. So we're going to assess for presence of vowel sounds in all 4 quadrants. So just imagine that you're dividing it into 4 squares. So it's a big square and then divide it into 4 smaller square, and you're gonna listen to all of those quadrants. Next, we're gonna palpate. So palpate for consistency, tenderness, masses, rigidity, any pain, any guarding. And if there's any abnormalities like that, stop palpating, document, do some intervention, and let your physician know. Assess the patient's arm, both left and right. Check for any pain, any swelling, any tenderness. And then you can check the patient's hand strength. Ask them to grip your hand. And then ask them to extend their arms as well. And if a patient has any IV site, make sure you check that as well. So again, IV site to source. Then check the patient's cap refill. Do it for all fingers. And then document your findings. Also check for patient's radial pulse. Next will be the lower extremity. So check the patient's leg, check for any swelling, any pain, any tenderness, any bruises, any lacerations, and always compare both extremities. Then check also the patient's feet for any swelling, especially if a patient is diabetic as well. And then check for general leg strength. So ask the patient to dorsiflex, plantar flex, and then bend each knee. And check both extremities again. Check for any swelling as well, any edema. And then check for pedal pulses, so the dorsalis pedis and the posterior tibial. And do it again for the right side and the left side. And do it for a full minute.
And that's it. You finished the head-to-toe assessment. Yay. Now you can wrap it up by cleaning up and thanking the patient for his or her cooperation and checking for safety again. So the bed is at the lowest position, the call bell is within reach, and then let the patient know that they can just push the call bell anytime they need anything from you, and then you have to document all of your findings. And then that's it, you're done. I hope you found this video helpful. If you know anyone else who might find this video beneficial, make sure you share it with them. And if you haven't watched the CBA preparation, I'll put the link below as well, and you can watch that. And also the workbook, so the free workbook, Survival Guide for IEN, it's a free download. There's a link below as well, and you can just click that and I will send it to you, and that will help you guide you in your NCLEX journey and your NCAS journey and your nursing journey here in Canada or in the US. Also, just want to share, I used to be a nursing student long time ago, a former nursing instructor and a coach and a mentor as well, is to take it one day at a time. Take a breather in between, take some breaks, and also just try to remember why you started. What are you trying to accomplish? So maybe if you're an IEN, you want to be a registered nurse again, you want to work again, you're passionate about it, but this time you're going to be doing it in Canada or in the US, and that's a big accomplishment already. So pat yourself in the back, you're doing so well. So keep going, keep growing, and if no one has told you yet, I believe in you and you're doing amazing, and I'll see you in the next video.
If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video!